When you hear the word microdosing, you might think about Silicon Valley tech bros and hustle culture, but research has actually been looking at microdosing as a potential treatment for depression and anxiety. That is, taking really small amounts of psychedelics without the hallucinations or the so-called trip. And while microdosing has yielded mixed results and has been heavily scrutinized by scientists in the past, today's guest on the podcast conducted the first double-blind, placebo-controlled, randomized trial on microdosing psilocybin for depression. So this is a high-quality study design and has not been done before, and he's going to be sharing his surprising results with us here today. Hello and welcome back to the integration session. I'm your host, Dr. Lena Koning, and today we're joined by Dr. Rotem Retranker, Director of the Canadian Centre for Psychedelic Science and co-founder of the Psychedelic Studies Research Program at the University of Toronto. I can't wait for you to hear more about his amazing work, so let's dive in.
Love it.
Hello, Dr. Rotem Retranker. Thank you so much for being here today. I'm really excited to chat with you about your work on microdosing for depression. So
My
it's a
pleasure.
topic we
Excited to be
haven't
here.
touched on yet. And yeah, excited to have you on. So thank you.
Yeah, my pleasure. I'm stoked to talk about what I do and hopefully come up with some new insights.
For sure. All right. So first question is an easy one. Just if you don't mind introducing yourself and telling me a little bit about your career trajectory and just how you became interested in psychedelic research and specifically microdosing for depression.
Sure. I'm Rotem. I did my undergrad at U of T, my master's at York, and then my PhD at McMaster. I never thought I'd study psychedelics. I thought they were cool, and I was always kind of interested in what I like to refer to as psychotechnologies. This is a word that I picked up from John Vervaeke. I learned a lot from him during my undergrad. Meditation, really language is also a psychotechnology, anything that kind of expands the mind. I was studying meditation and sustained attention before I had the opportunity to get into psychedelics a little bit more. That was through a colleague, Corey Weissman, who's a psychiatrist. He invited me to a reading group where they were just going to talk about psychedelics and just follow what the science is. And when I came for the first time, I think it was the first year of my master's, and I said, guys, it's me and a bunch of psychiatry residents. I said, we should be a powerhouse. We couldn't do this research and not just read about it. And some of the people were interested, including Corey and Dan Rosenbaum and Emma Hapke. They're all, I think some of them are now still, Dan and Emma are for sure still doing psychedelics research with UHN. And I also invited Thomas Anderson, who was my really partner in this work for several years. And so really we weren't committed to microdosing at all. We were interested in psychedelics in general. And just at the time, interest in microdosing was booming and there was no published research. And so we wanted to do something that we could do with people that have no funding, no support, and that was a survey. And then, we published one of the first papers about microdosing, and then I just kind of got pigeonholed. I'm now the microdosing guy. It's interesting. I don't mind it, but I think there's so many other interesting things about psychedelics too.
Definitely. Yeah. You can kind of, I feel like, become known for something and then get a little categorized by that in the research world. So,
Yeah.
I mean, it's not a bad topic. It's definitely an interesting one. And yeah, you mentioned sort of like the rise in the interest in microdosing, and we recently did an episode on the history of psychedelic research, but we didn't touch much on microdosing. So do you know anything about where that sort of fits in the timeline of psychedelic research and when researchers started looking into it?
Yeah, so I actually have there's a book that I want to recommend for anyone who's interested about kind of the first wave of microdosing. Oh, this is mirror, but it says The Science of Microdosing Psychedelics. It's by Torsten Passy.
Okay.
And it compiles a bunch of the first wave of research on psychedelics. I think it's very, very informative. Broadly, there wasn't a ton in the first wave, meaning in the like 50s and 60s, people weren't so interested in this. Jim Fadiman was a notable exception. And he did do a little bit of work, but his work was actually interrupted by the criminalization of these substances, and then it was kind of dormant. I think that microdosing is a lot more popular now, partly because it's for people who maybe want the benefits but don't want the experience. And I think that in the first wave of psychedelic research, the experience was kind of a big deal. It was part of the culture, whereas now I think there's a lot more effort to make the psychedelic substance fit into the predominantly, capitalist culture.
Yeah. And before we get much further, do you mind just defining for our listeners who don't know exactly what microdosing is? If there is a defined sort of or
Yeah,
a consolidated definition of it yet?
that's a really good question because there isn't one. And this is something that I've been interested in for a long time because the way Jim Fadiman, the kind of godfather of psychedelic research, defined microdosing as a a subperceptual dose. And that never really worked for me because, for one thing, you notice that you have taken something, so you have perceived that, and it at least probably affects your placebo effect. But in addition, I think a lot of people take doses like out in the wild. During the surveys we ran, people take doses that are high enough for them to feel something, and they still consider it to be microdosing. So I feel like it's not a good definition. Another one that I've used before and some other colleagues have used before is subhallucinogenic. I think it's insufficiently descriptive because there's a huge range of those doses. And then I assume we're going to talk a little bit about my trial results too.
Yes.
But in a word, I think based on my results, I think that the correct definition for now at least is unimpairing. This is an unimpairing dose. So people feel it. They feel that they've done something, but it does not affect their ability to kind of act in the world as they normally do.
Okay, yeah, that makes sense. Thank you. And I'm sure a lot of people, when they hear microdosing, kind of think of like Silicon Valley, like tech executives and celebrities sort of like experimenting with it. So what do you make of the recreational use and some of the public discourse around microdosing psychedelics? And how does that kind of impact the research, you think?
Those are three big questions. So what do I think about recreational use? I don't have any issues with it. I think people should be allowed to use substances. People have bodily autonomy. And if people develop substance use disorders, then that is a mental health concern and not a legal concern. Can you repeat the other two questions?
Yeah, I was just wondering sort of how the public discourse or opinions of microdosing and the recreational use can impact the research.
Oh yeah, to a huge extent. My colleague Tassin Noorani coined this phrase, the Pollan effect. And by that he refers to Michael Pollan, who wrote How to Change Your Mind and kind of created a huge ripple in public opinion and public acceptance of psychedelics, but also in public expectation of what psychedelics might be able to do for you. And I think Tassin normally talks about it more in the context of large dose studies, but I think it affects small dose studies as well. The placebo effect we saw in our trial, I'll talk a lot more about that later, but in a word, was much bigger than what you expect in a normal pharmacological intervention. And I think it's because people came in and had huge expectations for what microdosing would do for them. So I think there's a real concern about how hopeful people are about microdosing right now. Part of it based on what, some Silicon Valley tech bros have said, some based on other people's very real experiences, but that may be fueled by a certain expectancy. And so I think there's a real risk right now that people might expect psychedelics to solve all their problems, and that includes also microdosing. And that is probably unrealistic. One more thing to say about that is that we don't know what possible negative side effects psychedelics may have, and that includes microdosing. And because normally when people take large doses, they do it once every few months, maybe few years. I'm less concerned about that. But with microdosing, because it's such chronic administration, there are concerns about some long-term negative health effects.
Yeah. And our understanding of the mechanisms, I feel like, has evolved over the years, but we still don't know everything. We don't know exactly how these substances are working. In terms of microdosing, what do you think is the current sort of state of mechanistic knowledge as to how microdosing can help people with depression?
I think it's putting the cart before the horse a little bit, because there's no strong evidence that microdosing can help with depression. So I think it's premature to ask about a mechanism. There have been a handful of studies that included some imaging, but I don't know that they found anything interesting, because with the imaging, they also include, one or two behavioral tasks or self-report tasks, and people didn't improve on anything, so it kind of doesn't matter what happened in the brain.
Yeah, good point. But yeah, let's turn to your trial that you did. So this was the first double-blind, placebo-controlled, randomized trial on microdosing psilocybin for major depressive disorder. So what makes this trial design, for people who aren't familiar with it, what makes it so robust compared to previous research on microdosing?
It's a good question, and for people who really want to dive into it, I recommend reading a paper that I published last year with some of my colleagues called Keeping the Promise. It's just a review of all the RCTs and quasi-experimental studies on microdosing until, I think, maybe late 2023. I don't actually remember. But a lot of the research up until that point, I think, was motivated by just wanting to get stuff out there, going fast. And there are many, many methodological issues. I feel like, I'm not sure who the audience is that might be listening to this, but unless they're very, very, experts in clinical trial design, these things may not necessarily mean a ton to them. In a word, it was very important for us to have a large enough sample, so we ended up with 39 people, whereas previous studies were like between 10 and 20. It was important for us to have a diagnosis of depression, whereas previous studies, if they did use depressed population, it was more like based on self-report. It was important for us to control the set and the setting, which are very, very important for psychedelic studies in general, and this is something that's been broadly neglected in other microdosing studies. We also pre-registered our hypotheses and the design, which is something that, apart from one group of colleagues from the Netherlands, Michiel van Elk and his team, as far as I know, no one else is doing that. I think these are kind of the first things that come to mind. These are the most burning issues that I wanted to address.
Yeah, so just to summarize, so you had two groups. One was taking a placebo pill and one was taking the psilocybin microdose. And you were saying that you standardized or controlled set and setting. So did they come in to like a medical center to take the microdose, or how did that work?
Yeah, so I guess that's also a good point. We also standardized the psilocybin. Many of the other studies used dry mushrooms, and the content of psilocybin in mushrooms varies by up to 500%. So could have varied widely between participants. We had a very consistent dose. And then, I'm happy to speak more about the design, but in terms of the setting, we had people come into a medical center where we also had kind of all the support for whatever we might need if there is a serious adverse event. And so people more or less had, the same rooms. We checked in with them at the beginning of every day to make sure that their mental set is not substantially different. We tried to really keep it consistent, because really this feels like something that ought to be important for a drug that affects or is affected by expectations so much.
Yeah, definitely. And what were your main outcomes? Obviously, this was a population of people with depression, so I'm sure you were measuring depressive symptoms, but what other things were you looking at?
So that's another thing. We were looking at depression. Another issue that I find in the psychedelic literature, and this is kind of a broadly psychology issue, Different people use different measures, and everyone uses the measure that they like, and then there's not a ton of crosstalk between different people that use different measures. So we use multiple measures for depression because we wanted to be able. So, for example, we use the QIDS, which is what the Imperial team normally uses, so we can compare apples to apples. And we used a few others so that we can compare to different teams whatever results we found. In addition to that, though, we were informed by previous surveys that we ran where we asked people kind of, what are the three main benefits, what are the three main drawbacks that you've experienced from microdosing? So we really wanted to explore whether microdosing in a lab affected any of these measures. So we looked at mindfulness, personality, creativity, attention. There's a lot of measures. Mm-hmm. And yeah, we wanted to see whether we'd be able to confirm what people are reporting in the wild in a lab study.
Nice, yeah. I think that's a good way to go about it. And yeah, so for the exciting part, in terms of the results, I think you mentioned over email that half of the results are published in your doctoral work, and then the other half were only recently analyzed. So could you walk us through the main results of the study?
Sure. So it's actually my dissertation only included the first half of the sample and only a handful of outcome measures. And then we're still analyzing. Some of this analysis is fairly complex because of reasons. But so I can say so far we've looked at all the depression scales. We looked at mindfulness, a couple of other things. So all of the none of the results are significant. When I say significant, I mean to say, so pretty much everyone that came into the study improved significantly regardless of their condition. So regardless of whether they were in the placebo or psilocybin condition, everyone got a lot better. And so that probably creates a lot of noise. It's difficult to see whether the psilocybin was kind of above and beyond the improvement that people experienced just by participating in the trial. Mm-hmm. That being said, there was a significant difference. So yeah, I don't want to get too technical, but what we were looking at is whether the slope of improvement was different between groups. So whether people in the psilocybin group improved more quickly than people in the placebo group. And what we found was that was the case. There was a significant result in the dysfunctional attitude scale, which is kind of like cognitive way of measuring tendency towards depression, depressive attitudes. And this is something that we also found a significant result on in our survey study. So this is confirming a previous result, which is something. And then we also found the inclusion of other and self was higher for people in the microdosing group. This scale essentially asks people how much their sense of self overlaps with other people in their lives. So like family, romantic partner, friends, stuff like that. And people in the microdosing group were higher in that too. That, again, I would consider that confirmatory because some people, myself included, have spoken about how one potential mechanism of how psychedelics work is by increasing a sense of connectedness. And I'm like, oh yeah, there it is. So there's still many results that we need to analyze, including sustained attention, creativity. These are just things that are fairly complex to score, and then we just need to analyze, and we don't have a ton of personnel to do it. But these are things that we're working on. My takeaway from this is maybe there's something, maybe there's nothing. It's possible that. So I guess we didn't really get into the design. So I quickly want to talk about the way the design was. So you mentioned, the first 4 weeks, people came in once a week on a Saturday and took what they didn't know what they were getting. We didn't know what they were getting. It was either placebo or 2 milligrams of psilocybin. And then after 4 weeks of that, we switched over to open label 4 weeks of psilocybin. That means that for the additional 4 weeks, people would come in once a week. Everyone would get psilocybin, and everyone knew that they were getting psilocybin. That way we wanted to look at differences, whether, it was expectancy, knowing that they were getting it, that was fueling the improvement, or if it's the substance itself. And I think that if I were to hear about these results, my first criticism would be, well, why are you guys doing this every week? No one in the wild microdoses every week. People microdose twice a week. So it's insufficient. To those people, I say, read my paper from 2019, because a lot of people do microdose once a week. It's the second most common frequency. And then the other thing is we wanted to include as many people as we could that are, I don't know how to say this, real people. Because we had to keep people in the lab for the whole day every time we dosed them. If we were to do this twice a week, that means that our participants would have to take a day off every week for 8 weeks straight. Most people can't afford to do that, and we wanted a real community sample. And I think we were successful in that. We got a good diversity of kind of race, age, gender. And so I think it's really important that we also consider that when designing trials. But at the same time, coming away from this, what I would say is probably microdosing 2 milligrams of psilocybin once a week for 8 weeks, probably not super effective.
Okay. Yeah, thank you. And thanks for walking us through sort of like the practical considerations too when you're doing a trial like this. So yeah, like you said, probably not effective. Would you say that this trial provides any sort of rationale to follow up with, let's say, like a larger sample with a more frequent microdosing schedule, or what would you say would be like the next step in this line of work?
Definitely. So the most obvious next step is I need to finish analyzing the data, because we don't know. For example, we also ask people to respond to a quick survey 3 days after each experimental session. So they come in on Saturday, they get a microdose, and then we ask them on Tuesday to say how they're feeling. We haven't analyzed that yet, and there may be an effect there. It might be that microdosing doesn't work acutely if it's once a week, but it works a couple days after. Also, in some of the measures, when I graph them, it looks like there might be something, an improvement at the very end. Now, it might be because participants knew that the end of the trial is approaching, and maybe they were telling themselves that surely they should be better by now, so they're acting better. It might be that people need either more doses or a longer dosing regimen. And so I think another study, really, if I could, what I would do is run basically either the same study or a very similar study. I think by now Health Canada would allow us to send people home, so we could do it twice a week. And I would include psychotherapy, because I think that it is unrealistic to expect these substances to work in the absence of therapy.
Yeah, I guess the standardized sort of or well-accepted model of psychedelic therapy is psychedelic-assisted psychotherapy, so the combination of both components. And do you think that there is, based on your work and what you're saying about the therapy component, do you think there would be a rationale yet to do like a study that compares a full dose of psilocybin, because it's been designated as an experimental treatment for treatment-resistant depression? Do you think you could do a study, or there'd be rationale to do a study where you compare the full dose with psychotherapy to a microdosing schedule with psychotherapy?
I think it would be premature to do. I mean, if someone would fund that, sure. But in terms of getting funding for something like that, I think you would first want to say, well, let me do this again. So the rationale for why this would potentially work with therapy is that the measure of depression that showed a bit of movement is a cognitive measure. So to me, as someone who also does therapy, I'm thinking this suggests that it made beliefs more malleable. That would lend itself well to maybe a short course of cognitive therapy. And so 8 weeks or 12 weeks of cognitive therapy along with a microdose weekly or bi-weekly, I think that's where it's at. And if we are able to show an effect with that's above and beyond what's normal with just CBT, then there would be cause to maybe compare it to large doses. But I'm not sure that we need to run a specific, one study that has both arms. I think it's sufficient if people work together, if I think part of the problem with this field writ large is that people play their cards close to their chest. They're not really open to collaboration. I think that if we talked more and realized that science is a collaborative enterprise and not something that you do on your own, if we say used the same measures or some of the same measures, if we were able to compare between trials, then we wouldn't need to do everything on our own. So I think that is the move.
Yeah, and that's definitely something I'm sort of hoping to accomplish with the podcast is
Great.
allowing researchers in psychedelic science to know what each other is up to, and at the end I'll ask you more specifics about where people can find your work, and hopefully that stimulates some collaboration. So definitely I agree with that. So I want to ask again your opinion on, or this, I haven't asked this yet, but your opinion on, so you found a significant, or not a significant, but a positive effect of the microdosing in both groups, so the placebo and the treatment group.
And that was significant, sorry.
Oh, that was
So
significant.
the difference between the groups was not significant in most things.
Okay.
Both groups had a huge, a significant effect, improvement on mood, like throughout, across the board.
Okay, cool. And okay, so in terms of the implications of microdosing and where it can kind of fit into like a conventional psychiatric care model, this is like probably looking into the future. Do you see it as a tool, maybe not specifically for like depressive like neurobiology, but maybe as a more just general, like it increases your well-being, it allows you to open up to psychotherapy more, maybe it takes away some of the rigid thinking patterns that cause resistance and reduced engagement in psychotherapy? Is that sort of a way that you see it being used in the future?
Potentially. It would have been easier for me to answer these questions if I had, for example, my creativity data analyzed, but I don't yet. So I think, like, here's the thing. A lot of people think, well, microdosing is such a small dose, and I'm not really, I can go to work, I can drive, although I wouldn't advise people to drive or work on anything serious necessarily. But people think that kind of there's no downside, so why not try it? And I'm here to say there might be a downside. It might be cardiotoxic. We don't know that it's not. This is the first time maybe in human history that people have microdosed for such a long time and have had access to psychedelics so easily. So it might be that if you're microdosing and you're really not getting anything out of it, or whatever you might be getting out of it, you need to weigh it against the possibility that it would cause you heart problems in the future. And if you are microdosing, I suggest that people take breaks in case it is indeed cardiotoxic.
Yeah. And do you know of other groups looking at microdosing, maybe in other psychiatric conditions as well?
Yeah, there's a group in New Zealand that's looking at microdosing LSD. They've been doing that work for a few years. I think they will publish probably a larger study than mine on microdosing LSD for MDD at the end of the year, maybe early next year. I don't know what their findings are. And I'm trying to think if there's a couple of other people, but I think generally what happens with microdosing is that people don't find a ton of effects and then they kind of stop studying it.
Yeah, I want to go back to what you said about sort of the community aspect of microdosing. Your study, I guess, alluded to that being an important aspect. So do you think that microdosing could help in, let's say, like social support or in a model of psychedelic therapy where it's maybe group or there's sort of like a collective meaning making? Do you think that could be a role for microdosing?
Yeah, I think in general, I believe in group therapy for psychedelics, and I wrote about that too. If anyone's interested, the name of the paper is something about neo-nihilism. I don't exactly remember. But it's there. And yeah, if the mechanism of action does include a sense of community and connectedness, then it's a no-brainer that group is the way to go. And so yeah, I think that would be another interesting design to compare, kind of putting people in a group and encouraging, discussion, encouraging collaboration, fostering the sense of community versus really keeping people individualized, which is kind of what we did, and seeing if the effects are different. Absolutely.
That's definitely an interesting further study. And in terms of other future directions, I know this is probably going to be informed by what you find when you finish analyzing the data. So your answer might change, but if you were to conduct like the next series of microdosing studies, how would you design those and what would you look at?
For sure. Excuse me. I think depression. I think with therapy. And yeah, probably more frequent dosing. Kind of the issue, so your listeners, viewers may know this, but there's kind of, you can either go in a more ecologically valid way with research, which means that you're kind of following people doing what they do in real life, and then whatever you find is more likely to be true to what people do in real life, but it's also a lot messier, and your results are less reliable. Or you can go the way we went and really try and control everything, do it in a lab setting. And then maybe this doesn't apply to the way people are in real life, but we are confident about what we found. So the other thing that I would be interested in doing is maybe creating a more ecologically valid design. So that includes maybe people come into the lab once a week, and the other time that they microdose, they're at home. We do track what it is that they're doing. We do try and monitor their set and setting, but we don't try to control it. And I think it would be interesting to see if, it's possible that having people in the lab for 8 hours while on a microdose made them feel not so great. Maybe completing tasks all day was not so fun. And if we were to just let them go on walks and do whatever they want, maybe that would actually improve their mood a lot more. So I think that's the other thing that I would do. Try for a more ecologically valid design.
Yeah, and I guess you could also maybe implement like a ecological momentary assessment or different types of measures in their environment instead of in the research setting. That would definitely be interesting. Yeah, and
Sure.
I think the whole model of microdosing and taking small doses of psychedelics in your regular life sort of lends itself to more accessibility and feasibility of psychedelic treatment. The preparation, dosing, integration model can be very demanding in terms of resources and professional oversight. So do you see that as being like an advantage of microdosing if it's shown to be effective and safe in the future?
Definitely, yeah. This is what I often say, using the same words. So, yeah, I think the feasibility is a huge issue. Large dose therapy costs, I don't know, $5,000-$10,000, and if microdosing is effective, and you can just take a pill every 3 days and feel a little bit better, then that's huge. Also requires less time commitment and less of potentially uncomfortable, intense psychological experience. Yeah, it would also make it more accessible, like you said, to people that maybe have chronic health conditions, that can't afford this therapy, that maybe really can't, or they can't take, a whole weekend. Maybe they're taking care of family, or, people have all kinds of circumstances. So if microdosing is effective, and if it, as you said, doesn't require preparation and integration, then yeah, that'd be amazing. But from my vantage point, I'm very skeptical that's how it is. I think that there's no magic bullet, and I think it might help perhaps, in conjunction with therapy or in conjunction with community building, something, because, there's no magic pill, and almost always it's the set and setting that matter most. So yeah, I'm thinking in particular, we had one participant who had not left their home for months before coming in because they were fairly depressed. And then they come in and they start feeling better already just from coming in, right? This is something that my collaborator, Dr. Adam Blackman, and I have been talking about for a while. I think he came up with the term the milieu effect. Was it that they come in and we treat them nice and we make them feel like they're contributing to science and society, and we ask them how they are, and that has a huge impact, and the microdosing is just a drop in that bucket? I would believe that.
Yeah, such a good point. And I appreciate the viewpoint that it's not a cure-all and it's not a magic bullet, because I think that message kind of gets lost sometimes in the media. Yeah, so I mean, individuals like yourselves are doing the important research to help get us there. So thank you, and really looking forward to hearing more about your results when they come out. So yeah, that brings me to my last question, which is more of a general, fun question, I guess, that I like to ask all the guests. So, what is a lesson that you think we can learn from psychedelics, whether we're taking them or engaging with them or just studying them and learning from people's stories? What's something that you think meaningfully applies to everyday life that we can all take into our lives?
I guess when you say we can all take into, I don't know, different people are different.
Yeah.
So I don't know that there's one thing that would apply for everyone. I think probably if you're taking it, if you're being too hard on yourself, you don't have to. And if you're not being hard enough on yourself, maybe you should be harder on yourself. I think this is a lot of time. I think what people get out of psychedelics is just like a bit of a recalibration of expectation. And sometimes I think people are like, oh yeah, I'm pretty great and I don't need to be so hard on myself all the time. And sometimes people are like, oh, I have been really neglecting myself and people around me and I need to get my act together. And so, yeah, I think maybe the lesson is it's good to stop from time to time and consider what it is that you're doing with your life and, recalibrate. That's it.
Yeah, definitely. It's true that it's such an individual thing, and maybe psychedelics can be sort of like that personalized treatment that we've been looking for in psychiatry. So it's a really good point. Yeah, well, thank you so much for being here and sharing your work with us. Like I mentioned, I would love for this to sort of foster collaboration amongst psychedelic researchers. So where can people find you and your work?
Psychedelicscience.ca is the website for the Canadian Centre for Psychedelic Science. There's only like if people Google Rotem psychedelics, there's really only one. So you'll find me.
Sounds good. Well, thanks again.
Yeah, my pleasure.
Thank you so much for listening to this fascinating conversation with Dr. Rotem Retranker. I'd like to thank the Centre for Psychedelics Health and Research at Queen's University and the support of our sponsors at the Ontario Brain Institute, the Canadian Biomarker Integration Network in Depression, and Providence Care Hospital. Until next time, be well and integrate wisely.